And good morning, I'm Dr. Deuk Magenschott. We are getting ready to get started with a patient who is here with 2 herniated discs in her neck. Shot, AP. And right now we are accessing 2, 3, 4, 5, everyone agree? Her spine, a little bit to my side, so come back to the lateral. We're a little bit off to her left, which I don't want. So I reposition, shot. We're trying to get our needle into the disc. That's always the first step, shot. All right, let's get a coker, AP. This patient has had ACDF in the past, 2 of them. One in Ohio and one in Florida. Perfect. Lateral. So you can see the tip. Show us the tip of the needle there. It's right in the middle of the spine where we want it to be on the front back view. Go ahead, Jordan, show us that. Great. Can you see this, Henry?
Yes, we can.
All right, so there's the tip of the needle. It's right dead center in the middle of the spine. Show us the disc space. There's the disc. It's that white thing. Okay, and we're right in the middle. Show us the metal plate from her prior fusion. That is the C3-C5 fusion. Then she had a fusion right above that, number 5, 6, and we're fixing today number 3, 4, 4, 5. She has adjacent segment disease. All right, let's go back to our lateral view. Now she also has an allergy to iodine, so we're not using any betadine or iodine today because we don't want to give her a reaction. Shot? All right, so there you go. The needle's going in quite nicely. All right, we're just about in the middle of the disc. And I'm going to do my discogram. Now, shot, you're not going to see the discogram because normally we have iodine. It's called Omnipaque. It's an iodine-based dye that you can see on the x-ray. But because she's allergic, we're not going to see it. We're not using it, obviously. But I am going to put the blue dye, which stains the herniated disc, degenerated disc, sorry, which is the herniated disc, by the way. Okay, now I've done my discogram. Again, we won't see it on x-ray, but I'm going to place my guide wire. Now this patient has neck pain that's radiating up to the back of her head. We call that cervicogenic headaches, when you have a headache that comes from your neck. Most headaches don't come from the neck. They come from migraines or other causes like stress, tension. There's cluster headaches. So there's lots of causes of headaches. Some are even more insidious, like infections and tumors. But this cause of headaches, called cervicogenic headache, means it's coming from the neck. And that's something we can fix with surgery. If you go back and look at our original publication on the Deuk laser disc repair, if you go back and look, you'll see that 2/3 of the patients had headaches from their neck up to the back of their head. All right, I think we need to magnify in a little. So I would bring it closer to you, just so I can see a little better. But so far, everything's going quite well. All right, very good. Now let's count. 2, 3, 4, 5. You want to count for me? Let's count on the lateral view, Henry. 2, 3, 4, 5. So we're going to do 4, 5, and 3, 4 today. We're going to finish the 4, 5, then we're going to do the Deuk slide. The Deuk spine slide. What, Deuk slide or Deuk spine slide? Deuk spine slide, which is literally sliding on the front of the vertebral body along the ALL, anterior longitudinal ligament, up to the next disc. We discovered it here. We pioneered it. Nobody else in the world had ever done it. And we started doing it 16 years ago, back in 2006, 2007. The summer of 6 and 7. All right. Very good. I'm taking my needle out, leaving the guide wire, x-ray. You always want to check your guide wire with the x-ray on a lateral view to make sure it doesn't move in. You don't want it moving back to the spinal cord. She has some broad shoulders. You can see those. Shoulders right up to C4, 5. Now, can you see this, Henry?
Yes, we can.
So I'm literally sliding. I just want to show you. Can you see down here?
Yes.
I'm literally sliding the dilator down gently twisting it, watching the tip of the guide wire shot to make sure the tip of the guide wire doesn't move in. We don't want it getting pinched and moving in. Shot. Again, if it moves in, then it's going to push on the spinal cord, which is bad. So we want to control it. Shot. And the way you make sure it doesn't move in is you take x-ray pictures as you go along. I can now feel the front of the spine. Show us the tip of the dilator and the front of the spine. There's the tip of the dilator. Show us the guide wire. It's sliding along. Perfect. Which is within the disc space. Show us the back of the guide wire. There's the back of the guide wire. Show us where the spinal cord is. Spinal cord is there, even further back. All the way to the spinous process. Even further to there. Right about there. Okay? So we are in front of the spinal cord. And now let's get an AP view to make sure we're centered, which we will be. We're going to show you a front-back view. We call it AP. And you'll see that the tip of the dilator is in the middle of the spine. Again, we'll see that metal plate that we saw earlier as well. All right, now show us the tip of the dilator. Right there. And there's the guide wire beyond it going off to the left foramen. And we're right in the center. Show us the center of the spine. Yep. So that's the center. Very good. Come on back. Any questions from our audience?
No current questions.
All right, just so you know, we're broadcasting live spine surgery at Deuk Spine Institute here in Florida. And it is now May 18th. May 18th. Okay. 2023. Thanks, Luis. All right. I hope you prep lateral pretty good, right? Yeah. All right. So while I'm doing this, let's run a video that shows why do people with a disc problem, a disc injury, get neck pain? Shot.
Traumatic injury on the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissue develops within the annular tear, causing neck pain. The inflamed annular tear generates pain signals. Additional injuries can cause worsening symptoms. Inflammation from the annular tear can spread to the nearby nerve roots, causing arm pain. Pain signals travel up the nerves to the brain, causing localized neck pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of neck pain. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back. We were just talking about our first patient to ever have the Deuk plasma rhizotomy done for knee pain. And she had it done 2 days ago. It was March 16th. May 16th, not March, May 16th, 2023. And I talked to her yesterday, I talked to her today. She has 0 knee pain. She was told by 3 orthopedic surgeons she needed knee replacement. We literally are going to change the world with the Deuk plasma rhizotomy procedure done here at Deuk Spine Institute. And patients who need hip replacements, knee replacements, are no longer going to need that surgery done. We're going to be able to fix it with a simple, small little 3mm cut, outpatient procedure. And we had our first patient already. I need irrigation. And she's very happy. She's up walking around. She had the outpatient procedure. It took 15 minutes to do.
Sedation, anesthetic.
We did it under sedation. And she has no more knee pain. So she's no longer getting a knee replacement. We're going to be doing more patients very soon. We have literally a list of people who want this procedure done. And many of them work here at Deuk Spine.
So we can save a lot of complications, DVT,
Yeah.
and post-operative pneumonia,
Yeah.
post-operative infection, joint
Yeah.
infection.
Yeah. Dr. Berndes is talking about all the complications that actually normally will happen with joint replacement surgeries.
And they're very hard because a lot of the patients are elderly, so
Yeah.
it's hard for them to overcome.
Now, we've talked about artificial discs in the spine and how they're no longer necessary because of the Deuk laser disc repair. But now we're going to have no longer a need for joint replacements. It's too early to say, of course, with any certainty, but the results are very positive. But more importantly, there's sound theory behind the treatment. Sound theory, meaning not sound theory like music, but we have very good basis for believing that this treatment is going to last. Because we've done it in the lower back and neck already, in thoracic, and it has lasted. It's simply a rhizotomy procedure. There's nothing too complicated. We didn't discover the rhizotomy procedure, but we discovered the Deuk plasma rhizotomy, which is a unique type of rhizotomy. All right, so right now we're at the back of the disc. I'm thinking I may want to actually go in further. So I want to bring the x-ray back in. I feel like I could get in deeper. So let's bring the fluoro back in, and I'm going to try to advance this tube a little bit further. I need some more distraction.
Lights on, please.
I feel like I need to get a little bit further in. I'm not happy with where we are. I can see there's some herniation deeper that I'm not able to get to where I'm at right now. So I'm going to advance the tip of my tube further in. All right, go lateral, please. Any questions from the audience?
No current questions.
All right, so folks, if you're wondering what are we doing here, you're watching the state-of-the-art spine surgery. This is a surgery that replaces fusions, artificial disc, laminectomy, foraminotomy, and it's done with a 4mm incision. Shot? Is that it? All right, I need a little shoulder pull from one of the nurses, and I need a neck inline traction slide extension. I got to be able to see the back of that disc, and this may be in the way, I don't know. Shot? All right, that's a little better. I want to go in, huh? Ready, everybody? Shot? I'm going to bring the dilator in further. Shot? That's perfect. Now, I'm going to bring this in, tube over the dilator. Remember, you can't advance the tube by itself. Shot? A little inline traction, everyone, and shot. That's a little bit better. Shot. There, that's perfect. That should be good. Everyone relax. Make sure the tube doesn't come backwards. There we go. All right, and we're off to the races. So are we on the educational video?
We are not, no.
Okay. Well, let's go ahead and go to the educational video on how the Deuk laser disc repair fixes neck pain, arm pain, headaches.
Disc herniations are a common cause of chronic neck pain. The inflamed annular tear causes neck pain. Inflammation of the nerve roots causes arm pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. It can take up to 12 months. If you have a herniated or bulging disc and neck pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. As you can see, when you have neck pain coming from a herniated disc, which is about 90% of the time the cause of neck pain, it's coming from inflammation within the back of your tear. It's called an annular tear. And annular tears by themselves don't cause pain because they don't get inflamed. If they do, it's only for a few days while it heals. The problem happens when the nuclear material or jelly tries to escape from the tear. And we have a new animation coming out shortly that I've been working on for months for our new website that will explain exactly how that works. And basically what's happening is when you get a herniated disc, it's from trauma, always trauma. And the tear happens, but also something else happens nobody ever talks about because nobody knows about until now. That is, the traumatic forces on the spine are transmitted as well to the nucleus pulposus adjacent to the annular tear. And what that does is it creates a fragmentation of the nucleus. There's a herniation right there. A fragmentation of the nucleus, okay? And when your nucleus fragments next to the tear, it breaks up into tiny little pieces. Those pieces can easily get squeezed out through the tear. And that's where your inflammation and pain come from. I wonder if Tom Azadul is watching. Azadul, if you're watching, let us know. There's more herniation right there, Azadul. Okay? I don't know if you're watching this. I hope you are. If you are, just say hi. His name will be Tambin Amin.
Duly noted. I will let you guys know.
If you see Tambin Amin on Facebook or something, that's Azadul in Sweden.
Mhm. Copy that.
And he's the one doing our new animations,
Can we have more towels in the anesthesia area, please? Towels, yes, please.
which will be coming out.
Anesthesia area, yeah.
All right, there's the foramen. There's some herniation in there. Any questions?
No current questions.
It's a bit unusual we don't have questions, isn't it?
I believe it's Thursday. Everybody's just waking up a little bit, and
All right.
but so far we have decent viewership.
But we definitely had it like on the calendar, right?
Yes, it was
All
on the calendar.
So we've done everything we can do. It's just the people are sleeping or not interested. We'd love to get some questions. Questions are good for everybody. They help people learn. And they give me an opportunity to explain things. All right, so we've already showed, that's a bone spur right there. Right there, you guys see it? That thing,
Yes, we
that
do.
ridge that I'm blasting with a laser, that's a bone spur. And it's right on top of that nerve. There's another one.
We have a comment from John on YouTube,
Hi, John on YouTube. Thanks for commenting.
and they said, I am having my virtual consult for my back tomorrow. I've already had the consult on my neck.
Hey, wonderful, John. So nice. Well, John, if I don't remember what we recommended, and I wouldn't talk about it here anyway, but if you were recommended for a cervical neck Deuk laser disc repair, this is it. You're watching it right now. This is what we do. So far, everything's going well for this patient, no problems. Just to remind you, she had fusion done in the past. If you didn't see the metal plates earlier, you can rewind and see them. And the fusion was successful for her down low, but she's had 2 of them already. And they were done several years apart because she developed what's called adjacent segment disease, which she's done again. And that's the problem with fusions and artificial discs. People get other discs wearing out because no matter what the surgeon does, that's part of the spine that you fuse or put the artificial disc into, it's going to get stiff. It's going to be stiffer. you know, and that stiffness transmits over to the other disc. So it's going to make the other joints wear out faster. You don't want artificial disc. You don't want fusion. Now, people were told for years, like 20 years, hey, if you want to avoid adjacent segment disease, then don't get a fusion, get an artificial disc. Well, guess what? A study just came out last year, and it's showing that if you get an artificial disc, the rate of adjacent segment disease is the same as a fusion. It's bad. So guess what, folks? There's only one surgery that can be done that doesn't increase adjacent segment disease, and that's Deuk laser disc repair. We don't get adjacent segment disease. Only artificial discs and fusions, because they're putting metal in your spine. All right? So if you don't get the metal and you don't do a laminectomy, then your spine remains stable. It won't develop adjacent segment disease. Avoid metal, avoid laminectomies, avoid removing natural parts of your spine. The Deuk laser disc repair, we don't take anything that's normal out, whereas all these other surgeries take normal things out, right? For example, if you had an ACDF here, they'd be taking your whole disc out in the front. We're leaving the disc there. So you don't need to have a cage put in after we're done here, because we didn't take the disc out. This is the future of spine surgery. You're seeing it today in 2023 at Deuk Spine Institute. I don't know if I told you guys earlier, but I think I mentioned that we're starting to treat knees, and eventually we'll treat hips. People who are recommended, they have knee pain, and they're told you need a replacement for your knee. Guess what? You don't need it anymore.
Thank you very much.
We've now done our first patient with the Deuk plasma rhizotomy, and basically we're saving her from getting a knee replacement. She's doing fantastic. We're going to start doing more of them. We may end up broadcasting a few later on so you guys could see what we're doing, but it takes literally 15 minutes to do. And it's outpatient. It's done with 3 little cuts around the knee, smaller than endoscopic surgery, only available at Deuk Spine Institute. All right, this is it right here. I'm in the foramen. I'm taking out a bone spur right there. And then we'll be done. I'm just going to sweep back and look, make sure we got everything. All right, beautiful. I don't see anything. Oh, there may be something there, so let's go look. You never want to leave anything back there behind, because then it could end up becoming problematic. So I'm going to get all this out right here. Any questions from the audience?
No current questions.
All right, well, oh, look at that herniation there. Oh, yeah. Look at that guy. That's cool. Let's grab it. I don't know if I can pull it out, but I'll try. You have a comment?
Yes, we do. It comes from Will on YouTube.
I think I got it. There it is. Let's take a look. Come on, guys. Check this out. I just pulled it out. You guys see it?
Yes, we do.
It's a little bloody. A lot of times these herniations are pushing on veins. So here, can you guys see this thing?
Yes, we can.
Let me line it up. It's pretty thin, but it's long. It's, and I grabbed it out with that. So here you go. Sorry, and you said you had a comment?
Yes, this comment comes from Will on YouTube. And they said,
Hi, Will. Welcome to our live stream.
Hi, doctor and everyone. I would like to know if I can send my MRI and scans via email, which is on an imaging exchange portal here in the UK.
We can probably take the imaging exchange portal information if you give us your login credentials, yes. So when you go to our website and you submit for the free MRI review, which you need to fill out, and then it'll give you the option to put your portal link and your login credentials. Okay? So use that. But yes, we can definitely use your portal. All right, so I found some more herniation over here. For this one, I'm going to try to cut into pieces, little pieces, and float them out. We can float a lot of this stuff out once it's small enough and less dense. So I just hit it with a laser until we, how are we doing on irrigation? I feel like our pressure is down a little bit. All right. A little bit, if you can. Where are you at now? Well, I don't think we can go much higher, right? He says no. I can manage. I just have to break the fragments up smaller. I don't want to ruin the machine. Yeah, so thank you from England. We have a lot of patients from England. They come here because they don't want the traditional fusions or artificial discs that are offered and recommended there. They want better, and I don't blame them. All right. Yeah, sure. Switching irrigation. This should be it. I should be just about done here. And then we're going to implement the Deuk spine slide. Appropriately named because it was first done here at Deuk Spine. I was inspired at the time, 16 years ago, to do the Deuk spine slide. I was inspired by the Macarena dance. And I thought, well, if people can slide so nicely on a dance floor, why can't I slide my instruments along the spine? Right? Perfectly logical thinking. All right, we're done here.
Lights on, please. Come on. Thank you.
Okay, so at this point, what we're going to do is, for those of you who are watched a lot of these surgeries, you know what we're going to do. We're not going to use any betadine, right? We're just going to irrigate with saline. And then we're going to actually move this contraption to the next disc. Alrighty then. We're going to bring our fluoro in, and we're going to remove the tube that we did the surgery through. Then we'll leave the dilator there, which I've just replaced. We're going to, under x-ray supervision, slide the Deuk spine slide of the dilator up to the next disc, which is C3-4. Everyone agree? C3-4? Any questions?
No current questions, but we do have a comment from a user on LinkedIn. The name is not shown, but they did say, "This is amazing."
Yeah, thank you. This is amazing, and unfortunately, it's not available everywhere. We're trying to change that because these surgeons that do spine surgery, they all want to do fusions and artificial discs. Those surgeries do pay much better than this to them. The surgeon's fees for this surgery are not as good. So they could lose a lot of money doing these surgeries. And of course, the hospitals won't make as much money, and the companies that sell the plates and screws won't make the money because we don't put any plates and screws. So unfortunately, everyone wins with fusions and artificial discs except for the patients. And that's why we're trying to be on your side and teach you guys that there's a better way to do spine surgery, but you're just not hearing about it. Because the hospitals don't want you to know, the doctors don't want you to know, and the companies who make all the screws, rods, that do all the marketing, they don't want you to know. So who's going to tell you if those people don't tell you? Your government's not going to tell you. The insurance companies sure as hell aren't going to tell you. They don't want you to have any spine surgery. So the fact that you only have fusion available, well, that's good for them because that keeps most people away. It's like having a pit bull beside your front gate. The mailman doesn't want to deliver the mail. They're scared. People are scared of fusions, and they should be. At least they figured that out. All right, that was the Deuk spine slide. I feel the disc. Shot. Okay, right there. Shot. Now, on the lateral view, I look good. Shot. On the AP view, I have no idea. So I'm going to go back to the AP, anterior posterior view, AP. Make sure I'm in the middle. You don't want to be entering the disc off to the side. You want to enter the center. So I'm off to the side. I don't want that. I'm going to bring it back to the middle. Shot. All right, there's the middle. Lateral view, please. You can see the metal plate from the prior surgery, the fusion that she had done. All right, that's perfect. So now I enter the annulus. And people say to me, well, Dr. Deuk, when you're going into the annulus, aren't you going to damage the disc? The answer is no. First of all, the disc is already damaged, obviously. But the annulus is part of the disc that's quite interesting. It can heal itself very well. And when you're going in, shot, with the dilator, you're actually not harming the annulus. You're spreading it, spreading the fibers. Because what a lot of people don't understand about the human body is that tissues are mostly fibrous. You know, not everything is fibrous, but a lot of your connective tissue and muscle are made out of fibers. And just like when you stick a pen into your lapel of your suit or a shirt, you're not actually damaging the material, Raytek. You are spreading the fibers. And when you take the pin out, you can actually push the fibers back together and you can't even tell where the pin was. All right, the tube is now down to the front of the spine. Shot. You see the dilator coming back a little bit. We don't want it to come back too far. So we need to advance the dilator again. Take that out. Huh? No. She has a normal disc. I mean a normal height. So it's not compressing anything. So go ahead. It's just probably some inflammatory shot pressure that's doing it. Any questions?
No current questions.
Shot. So I'm going to advance the dilator again. Take this off. I'll leave that. I'll do that. You just grab that top part. Shot. Uh-huh. Uh-huh. Yep. Shot. Off.
Okay.
Shot. Almost there. Some people don't like seeing me hammering above the spinal cord like that. It makes them very nervous, and honestly, I don't blame you for feeling that way. It made me nervous the first couple of 100 times I did it, and then, of course, I started to get a feel for it, really nice feel, and I know exactly how much to hit the hammer, how much force to apply. People think the hammer is kind of like hammering a nail in. You want to hit it as hard as you can. You don't. The hammer is really quite interesting. In surgery, hammers are used to deliver very specific amounts of force. And in spine surgery like this, it's never maximum force. It's always something far less. But sometimes in orthopedic surgery, when you're doing nails and stuff, you gotta hit harder, but not in spine surgery. So it does look brutal, but it's not really that bad, to be quite honest. All right, so here we are inside the disc, inside the back of the disc where the tear is, and already we have little pieces of herniation coming out. The nice thing about this system is that you know exactly where you are, you know, based on the x-ray. And then when you look down with the scope, you can actually see the anatomy that that tells you, yes, you are in the right spot. And that is, you can see the annular tear, you can see the herniation, you can see the end plates eventually, like there's an end plate over there. Those are the things I'm looking for. Look at all the herniations coming out of the hold back there. See that? Boom, there's another one. Just literally lifted right out of from on top of the spinal cord. There's a herniation. That's a herniation, folks, right there. I didn't create that. That was already created by the patient. There's another one. See them popping out of that gap back there? So this reinforces what I've told people, there's another one, for years, which is a herniated disc is not one piece. It's 20 or 30 or 40 pieces that happen over years, like 20, 30, 40 years. It's best to get your disc fixed so you don't keep getting herniations. All right. Yes, you have a question.
We have a comment and a question. The first comment comes from Will, once more on YouTube.
There's another herniation. Okay, just came out from around the spinal cord. Yeah, sorry, go ahead.
Will said, thank you for the instructions. I am a great follower of your surgeries. I have a herniated disc at C4-5 and L5 and at L5S1. I have received the radiologist reports and waiting for the exchange portal link.
Wonderful. That's great to hear, Will. We look forward to meeting with you and figuring out what to do to fix your problem. We have not found any neck pain or back pain that we cannot cure. The only thing that keeps us from curing everyone's pain is for them to come here and get it cured. Literally. And I don't mean that in a boastful way. I'm being serious. You know, I've reflected on this because we're doing a study right now looking at the causes of back and neck pain in thousands and thousands of our patients. We're going to publish this results very soon, but we're very close to being done. Our research fellow is close to having the final numbers, but what I can tell you is of all the causes of back pain, neck pain, there's not one single diagnosis of fibromyalgia. And why is that significant? Because I grew up believing fibromyalgia was a cause of most back and neck pain. That's what I was taught in my training in neurosurgery, and they were dead wrong. And I didn't know it at the time. I had no idea they were wrong. But then when I got out in practice and I started seeing patients with back pain and neck pain, and they told me they had fibromyalgia, and I said, okay, well, you've also got a herniated disc, and let's fix that, because I think that's contributing to your pain. So I started to do fusions, and of course artificial discs and fusions on the discs that I thought were painful. And something amazing happened. Their pain went away. Not just a little bit, not 50%, 100%. Now they carried diagnoses of fibromyalgia at the time. So I immediately started recognizing that, hey, wait a second, you have a diagnosis of fibromyalgia. So why is your pain gone? Fibromyalgia is not curable. Fibromyalgia is a life sentence of pain that comes from soft tissues that's not curable. And then I started to realize there's a lot of people diagnosed with fibromyalgia that come to me and we cure their pain. I've never seen one whose pain we didn't cure. So basically what I'm saying to you is every single person that came here to Deuk Spine and got fixed by us with fibromyalgia, they didn't have a diagnosis of fibromyalgia, even though they were diagnosed with fibromyalgia elsewhere. And the reason is fibromyalgia pain never goes away. It is not curable. That's the definition of fibromyalgia pain. It comes from the soft tissues and it's not curable. So basically what I'm telling you folks, and this is very important, is that there is no such thing as fibromyalgia. I truly believe that today. That diagnosis will eventually go away. Because the real reason that fibromyalgia is, I'm going to tell you what it is the doctor has no clue what's causing your pain. That is what fibromyalgia is. The doctor has no clue what's causing your pain. They don't know the diagnosis. And I'll be honest with you, making the diagnosis is not easy. It's not something that I woke up one day, you know, stayed in a Holiday Inn Express and I can make the diagnoses. It took me years to learn all the causes of back pain and neck pain. And once I learned them, I started to look on every patient I saw in clinic. I started to ask myself, does the patient have this cause, this cause A, cause B, cause C? And I figured out, hey, most people actually have a herniated disc as their cause. And I did surgery on those discs, and guess what? Their pain went away. It went away 100%. So number one, there is no fibromyalgia. And number two, most of the pain actually comes from discs that are damaged. Then I started doing endoscopic surgery. And when I'm doing the endoscopic surgery, I'm literally just fixing a small area of the disc. Whereas when you do a fusion, you fix the whole disc, like you're fusing the whole disc. So when you do a fusion and you get rid of somebody's pain, you say to yourself, okay, the pain was probably coming from the disc or the facet joint, right? Because that's where the pain comes from normally, is disc or facet. But then when I started doing the Deuk laser disc repair on the disc, I was no longer treating the facets, because fusions treat the facets as well. And my patients were getting cured, and I realized very quickly, wait a second, if I'm doing the Deuk laser disc repair and it's curing their pain, that means their pain's not coming from their facet joints, just the disc. Because I wasn't treating the facets during the Deuk laser disc repair. So, of course, we had a few patients where they had pain in their facets after the surgery on their disc, and we knew that, hey, they had facet pain also, you know. And it was the same pain as before surgery. It wasn't something I gave them. It's they had it. They just intermittently had it. Long story short, it wasn't long before we realized most pain I got 2 minutes. Most pain comes from the disc. And then we started to say, well, how much? So that's why we started this study looking back at all these patients, thousands. And we're looking at literally 5,000 patients with back pain, chronic back pain, and breaking them into what is the cause? Primary cause, secondary cause, tertiary cause, quaternary cause. That's number 1, 2, 3, 4, 5, for those who don't know. And, oh, look at that. Oh, yeah, baby. That's a herniation. So many herniations at this 3-4, right? Oh, come on. Trying to get it to float out. Just doesn't want to float out. Gotcha. Almost done. Some scar tissue. This is all scar tissue right here. It's white stuff, scar tissue from inflammation, chronic inflammation in the back of the disc. That's from your herniation. All right, I just got this last bit to get, and we're done. All right, Berndes? Yeah.
We have a question.
Sure.
This comes from LinkedIn user once more, and they asked, any update on the laser manufacturers corporation with hardware or support availability here or abroad to expand your technique amongst fellow practitioners? And I also agree on the fibromyalgia pain causes.
Yeah, so first of all, very insightful questions from LinkedIn. We don't have your name, but thank you for contributing. So number one, here's the deal. And you've heard me say this before, perhaps you have, other people have. There's something called the spinal industrial complex, okay? And what it means is there are people getting very rich off these surgeries. And I'm not talking about me. I'm talking about the ones doing fusions and artificial discs. And the people getting rich, the surgeons are making good money, really good money. And they're making the best money they can make, by the way. You can't make more money doing anything else. Even if you do brain surgery, you make less, okay? Less than fusions. So, who's making all the money? And the answer is these companies that sell the metal implants. They're the ones making all the money. They're making literally $100 billion a year, okay? And they are driving the demand for fusions by marketing to surgeons. Who do you go to find out what to do with your spine? You go to your doctor, you go to your surgeon. So by controlling the surgeons, they're controlling the recommendations to the patients. So they have these surgeons eating out of their palm because they're either giving them kickbacks, financial kickbacks, or they're giving them high pay reimbursements for these surgeries, and they're actually getting both. So the implant companies, there's an entire culture in spine, both orthopedic and neuro combined. And if you go to all the meetings are just dominated by these companies like Medtronic, Nuvasive, Alphatec, DePuy, Johnson & Johnson, and then even more. Those are just a few of the big ones. And they're actually literally at the meetings. They have booths. They have sexy little reps, male or female, it just depends on your preference, wearing mini skirts, standing at booths trying to sell their new metal to you, the doctor. They wine and dine you. I don't do any of this shit because it disgusts me. But I see them going out to dinners together. I go to the restaurants, I pay my own bill. I go with myself or my wife or my kid. But I could see them in the restaurants. I see the reps, I see the doctors there with the surgeons. They're buying them wines, expensive wine, drinks, steak dinners. And in exchange, the surgeons are recommending fusions and fusions and fusions and fusions. And, oh, by the way, laminectomies, which then become fusions as the next surgery. I literally have watched this for 25 years playing out. And it's getting worse and worse and worse. So all these surgeons, spine surgeons, are basically like a little lapdog of these giant implant companies making billions of dollars for the surgeons implanting their hardware into patients. And it's not just steak dinners. It's also the chairmen of the training programs for orthopedic spine surgeons and neurosurgeons. They're on the take. The department is on the take. They're getting money, millions of dollars in unrestricted educational grants. I mean, I could go on and on. But the whole system is so corrupt, and it's just so harmful to patients that somebody has to see it and speak out about it. That's me. So we're using our social media platforms, we're using our spine surgeries to teach people that have these spine conditions to understand there's options other than what they're being told by their, what do you call it when somebody's controlled by the industry? They're puppets. They're puppet surgeons. All right. So a little bit of vein bleeding there. No big deal. We're going to hold pressure for a few minutes. And that's probably if I had to guess, what's called the external jugular. We don't know 100%, but that's the external jugular. Remember, she's had 2 prior surgeries, so she's got scar tissue and some abnormal veins and stuff. No big deal. That's not a big problem. We're just going to hold pressure for a few minutes. But I want to show you. Can you see this, Henry? How small the incision is?
Yes, we
You
can.
have the tape measure? So if you do this kind of surgery, at the end you want to hold pressure for a few minutes for venous bleeding. We've never had any arterial bleeding. There is the incision. It's about 4 millimeters, okay? Can you see that?
Yes, we can.
All right, very good. All right, so we're going to put a little bandage on there, like a little Band-Aid, and we're done. She did great. We're going to take the tube out, wake her up. She's under general anesthesia. This is outpatient surgery. Takes an hour to do and an hour to recover. Patients go home. No need for metal. And by the way, none of these patients get opioids or narcotics after surgery. This is so gentle that there's no damage inside your body by my surgery. Whereas if this patient had an ACDF or artificial disc, she wouldn't be able to swallow, right? If you've had an ACDF done, artificial disc, you can't swallow afterwards. There's so much trauma done by the surgeon during the surgery on your swallowing tube and breathing tubes that you're screwed up for a long time. You can't talk, you can't swallow. There's a reason for that, folks. It's trauma from the surgery. And of course you need to take narcotic opioid painkillers to ease the pain of the surgery. With this surgery, no trouble swallowing, no trouble talking, no pain, minimal pain. We give them Tylenol. That's it. This is it. It's going to revolutionize spine surgery and spine care in the whole world. But the problem is getting past, these big corporations is almost impossible for one little company to do where it was discovered. So that's why we go straight to the source, the people. It's got to be a grassroots effort. All right, type up your questions. I'll come answer them for you in a few minutes. But we're done. This was a 2-level cervical Deuk laser disc repair. If you're interested, you can go look up our publications on PubMed, which is the National Library of Medicine. just type in a Google PubMed, P-U-B-M-E-D. Henry, you put a link, and then just type in Deuk laser disc repair. Once you get the PubMed, you'll see some of our publications. Okay? Peer reviewed. Type up your questions. I'll be there in about 5 minutes to answer them. This is Dr. Deuk Major. I'm here with one of my patients who underwent the Deuk laser disc repair on his neck just yesterday. How you feeling?
I'm feeling better, a lot better. Already, after years of chronic neck pain, I'm already feeling better within 24 hours.
So is the pain that you had when you came here, do you still have that pain?
Not that pain, it's just, I think, a little bit from the surgery itself, but it seems like a lot of the numbness and the tingling in my hands went away, and already starting to feel a lot better.
Now you had a fusion done before, not by me, and you can see the scar there. And then you had the laser surgery done yesterday. And how would you compare the two experiences?
Night and day. I actually, when I had the fusion, had to go back to the hospital with complications. And it just took a long time to recover from that. So this was much, much better.
Now, your fusion on your neck was done by a pretty famous neurosurgeon, right?
Correct.
Even with him doing it, there were still issues.
Yes.
What kind of problems did you have with the fusion?
Well, I went there for the numbness in the hand and still the chronic pain that I've had for many, many years. And it seemed to take away the numbness in my hand, but the pain was still there. So I spent many, many years going to chiropractors. I've had injections, I've had massage therapy, physical therapy, and it, most of them gave a little bit of relief.
Did any of them get rid of your pain?
Not completely, no. Just kind of made it bearable.
And is your pain gone now?
It's certainly getting there. I'm thinking probably within a week it'll all be gone.
And your surgery was done, even though you had a metal plate in your neck from your prior fusion, we were able to work around the plate and get in there and fix those discs, especially the C3-4, which was, you can see a lot of herniated disc material in there that was causing most of your symptoms. So I'm happy you're doing so well. And you had it outpatient, so you didn't even have to go to the hospital.
Correct. Yeah. Left in about an hour and a half.
What are you going to do now that we fixed your neck?
Well, I'm going to take care of it for the prescribed 6 weeks, and then hopefully I can start getting back to a normal life, be able to get back to golf and things I like to do. Dr. Deuk and his processes here and everything's amazing. If you have a lot of chronic neck pain or back pain, I would highly suggest coming to him.
Awesome. All right, my friend. Congratulations. Good morning, I'm Dr. Deuk Major. It's December 9th, 2022, and I have with me one of my patients who traveled from out of state, Texas to be exact.
Yes, sir.
And he is suffering with neck pain, and I'll let him tell you a little bit more about his symptoms, but he had herniated discs in his neck along with degenerated disc. We just repaired those yesterday, less than about 12 hours ago.
Yes,
as a matter
sir.
of fact.
Yes, Doc. Yeah.
You're here now on post-op day 1. It was outpatient, no hospitalization. You stayed at the hotel. You're back this morning, and how do you feel?
I feel great, Doc. I just want to thank you right off the bat for you and your team for basically giving me another lease on life. I mean, the back of my neck, the tops of my shoulders. I had pain all the way down the back of my arm, and my elbow, and then also I had no grip. And today, it's all back. I just, it's just a game changer. His procedures, because I've had fusions in the past, like 15 years ago, and those fusions, you don't want to do those because they just give you adjacent disc disease, and I have that problem right now on my back, and Dr. Deuk is going to fix it next week, so I'm very looking forward to doing that.
We'll be seeing him again next week after his back is fixed, but You broke it up into 2 procedures, and we get people all the time asking us, oh, can I come there and get my neck and my back fixed? Yes, you can. We'll probably do it on separate days. So you got 3 discs repaired yesterday. You can
Yes, sir.
actually see right here in this video footage how small the incision is, tiny. And I was in there endoscopically using a laser to clean out the tear and remove the small herniations. And now here, we sent you home an hour after your surgery, and here you are back today. And how much of that pain did we get rid of?
All of it, Doc.
100%.
100%. And the doctor did, they did surgery on 3 different levels and through a really small hole.
4 millimeters.
Yes,
4
Doc.
millimeters. Incredible.
There's no stitches. It's just a Band-Aid.
Yeah.
You know, that's crazy. You know, if you have a fusion for three level fusion, I don't know how long that would be, but it's
it's
terrible.
about that long
Yeah.
for a 3-level fusion. And then of course you'll have swallowing trouble for months,
not
and
good.
then you'll have pain, and you'll be on narcotics. Are you on any opioids or narcotics?
No, Doc. Last night I went home and to the hotel, and I just took a Tylenol PM, and that's all the medication I've taken since the surgery.
Yeah. So with the Deuk laser disc repair, you don't have to worry about getting addicted to painkillers, because there are no painkillers. Literally a Tylenol, and that's it, because it's so minimally invasive. Far better than ACDF, far better than any other cervical type of surgery. Well, is there anything else you want to tell your fans out there before we wrap this up?
Yeah, I just want to let my parents know, and my 10 younger brothers and sisters, if you're watching this, if you have back issues, you need to come see Dr. Deuk, because he is one of the only people in the world that can do this procedure, and it is a game changer, and it's well worth it. At least give him a review. He'll do a free MRI review for you. It's just do your research. Go to his deukspine.com, look at his website, and just do your research and give yourself a chance to do the right thing.
Well, thank you. And yes, now I'm the only one, but someday there will be another one
You hope.
who will be doing these
Yeah.
surgeries,
Yeah.
and probably better than me.
Okay, thanks, Doc. Appreciate
Thank
your
you,
help.
sir.
Yeah.
We'll see you soon.
Yeah.
All right, I hope you enjoyed that testimonial from that patient as much as I did. And we have just completed doing a repair, Deuk laser disc repair, done here at Deuk Spine Institute, only here at Deuk Spine Institute, on a patient who has already had a fusion done, actually 2 fusions, and now the disc above the fusion, 2 of them have worn out. We call it adjacent segment disease. And because she has adjacent segment disease, she got neck pain that radiated up to the back of her head, like in this area. We call that a cervicogenic headache. And if you go onto PubMed, like Henry put the link there, you type in Deuk laser disc repair, read one of my papers that we published about the outcomes. You'll see that patients with headaches in the back of their head, we got rid of, I think it was 92% of the headache, like on average, 92% on average of the headache, which is phenomenal, because most headaches are permanent. You can't get rid of them. You just treat them with medications. So to have a type of headache that you can cure is amazing and wonderful. Okay. Anyway, the surgery went very well. We made 1 small 4 millimeter incision, and I fixed both discs. We did the Deuk spine slide along the anterior longitudinal ligament, which, by the way, if you're looking at the spine, this is the front of the spine where the plate is, and this little white thing here is the ALL, anterior longitudinal ligament. And we slid from one disc to the other. That was a technique developed here at Deuk Spine. Someday it'd probably be employed elsewhere around the world, but we've been doing it here for 16 years, since 2006, 7, and so we developed that in order to be able to treat more than 1 disc at a time. All right, everything went well with her surgery. She'll spend an hour recovering, and then she'll go home. I know we have some questions.
Yes, a question and a couple comments. This comment seems pretty important. This comes from Trust on YouTube. And
Give me 1 second.
Yeah.
Can you go and help Kim in pre-op? There's a bit of a misunderstanding.
Jordan again?
No,
Oh, okay, because I spoke
One
to him
from
for half an hour
yesterday.
Wednesday.
just one from yesterday. 2 discs, 2 facets, only the facets.
This from Trust on YouTube, and they said, me watching your live videos, I learned so much, and my sister is diagnosed with fibromyalgia. Pain in her leg. She finally listened to me and got an MRI, and guess what? Yeah, she has multiple herniated discs in her back and lumbar. We couldn't believe it. She finally sent her MRI to you. I pray you can cure her of her pain.
Thank you, Trust, and thank you for trusting Deuk Spine. So what Trust just said is a fascinating story, but all too common. And thank God Trust found us, because I think that led to her convincing her sister, who is diagnosed with fibromyalgia, to go and get an MRI scan and then come see Deuk Spine and see if it's something fixable. And it turns out it is. So what Trust's sister has is a herniated disc, the red thing, which is the jelly in the center coming out through a tear, pushing on the nerves, right? The yellow thing. These nerves actually go down your leg. So if they get pinched in your back from the herniations, they'll cause leg symptoms. And shame on the doctors for missing this stuff. I mean, it's so sad because these patients have to live in pain every single day. They're literally robbed of their quality of life because these doctors can't make the right diagnosis. And it's not hard, folks. It's easy. I can almost do it with my eyes closed, seriously. So the fact that all these doctors are ignorant about herniated disc and the symptoms caused by them is shameful. And it has a profound impact on everybody in the world. And I can't even imagine having to go day to day with horrible pain that I'm being told by my doctor is not curable, and I have to live with it. Like, I wouldn't want to live. I wouldn't want to do anything. I mean, and that's how these people feel with chronic back pain. It's wrong. The doctors are wrong. They need to be corrected, but they're too arrogant. They don't believe. They're too entrenched in the system. The system is completely broken. And I need to get the word out so everybody knows that it can be fixed, that it's not something you have to live with the rest of your life, that it's not fibromyalgia. It's totally curable with a 15-minute, 20-minute surgery. Okay? So thanks for sharing, Trust. And I'm expecting that we'll be able to help your sister. I know we will. I'm 100% sure of it. I just don't know what needs to be done exactly yet. Yeah.
And then the question comes from Maria on YouTube. And they ask, what can you do if you have spinal stenosis that causes my back pain when I walk or stand up for a long time?
So Maria, great question. First of all, I'm going to have to rock your world. Spinal stenosis does not cause back pain, ever. Spinal stenosis causes leg pain. So you've been taught or told or somehow misinformed that stenosis, which is a narrowing, by the way, of the holes where these nerves come out of your spine, okay? They're called neuroforamen, and there's other areas called lateral recess, central canal, and that's what's being narrowed. You have spinal stenosis there. But spinal stenosis causes pinched nerves. Pinched nerves causes leg pain, weakness, numbness, tingling in the legs. Leg, 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 never back. Spinal stenosis never causes back pain. What does cause back pain, if you go, look at some of our videos on YouTube, is the tear in the back of your disc where the herniation has come out of. You have a herniated disc. That tear is the cause of your back pain. It's totally fixable, but it's nothing to do with spinal stenosis, which is a big part of the problem, because the problem is people come to the doctor, they have back pain, it's coming from a tear, maybe a small disc herniation, really not any spinal stenosis at all, and the doctor's saying there's nothing wrong, go to therapy, take pills, give it time, and they don't get any better, because the tear is the cause, not spinal stenosis. So there's a lot of misinformation out there, and people are suffering needlessly as a result of it. We're trying to change that.
And that is it for questions.
All right, I hope you enjoyed the surgery. We'll be back soon with another surgery. We're trying to sort things out, but I think we have just a Deuk plasma rhizotomy next, and then another Deuk plasma rhizotomy. I think our next patient is from Boca Raton, Florida.
From there.
Yeah, Henry's tearing. And then our last patient is from Austin, Texas, originally California, but he's living in Austin and he's here for his back. All right, hope you enjoyed it, and we'll see you back in about